In this video, I'm going to share with you the best way to record your clinical procedures through video, specifically 4K high quality footage that you can mount on your loupes. I'll be discussing all the different options of videos, whether you can use your phone or other devices and what's out there in the market, and homing in on the OXO 4K device, which I think is the best. Now, if you're impatient like me, you can skip all the background and all the different options of video, you can go straight to the review of the OXO 4K camera. Then if you see below, there's different chapters. And if you click on the OXO review part, it will take you straight to the good bit. My name is Dr. Jaz Galati. I'm a general dentist based in Reading, and I've been obsessed with video since I was a kid. I used to literally record home movies, and my love for video grew and grew, and I really wanted a way to start recording my procedures to marry my love of dentistry and my love of video. Don't get me wrong, there's a huge value in taking good quality DSLR photos, but there's something special about video, and you've seen it yourself on social media. There's been a huge boom in clinical videos, and everyone's looking for ways to improve their clinical videos, which is what this video is all about. Now, as you're watching this review, you're probably already sold on video. You know why it's a good idea to record video in 2023 and 2024. But 3 reasons I can give you that's really helped me is the ability to get really specific advice from mentors. Sometimes I'm doing a clinical procedure and I find it tricky, or if I'm doing something for the first time, I'll record it and I'll send it to my mentor. The amount of specific feedback that you get that you can apply straight away is amazing. Photos are good, but video gives you so much more information to your mentor about the way you hold an instrument or the timing of when you might do a certain step. So if you're wanting to get mentored, it is fantastic. The second reason, as I alluded to earlier, is social media. Video is huge for marketing your practice and your dentistry, and my patients love it. Patients love to see clinical videos and explanations, and this really is the future. The third one is more specific to me, and it might not be to everyone, is education. I teach a lot of courses, including occlusion and occlusive appliances, and it's been great to be able to add clinical videos. So it's like a point of view, and it's allowed me to make so many YouTube videos, as you've seen. Without my clinical footage using the OXO camera, a lot of the content on this channel wouldn't be possible. Now, before I go deeper into why I picked the OXO instead of, Futudent or GoPro, I'm going to cover something a bit more basic. We all have phones, and these phones have fantastic cameras. So there's actually a lot we can do with our mobile phones. So I'll talk to you about using the phone as your video recording device for your clinical procedures, and what my experiments have shown, and a few top tips I can give you if you're looking to start out that way. I can tell you already, before we even talk about the phone, that if you have a scope and you can mount a DSLR camera on your scope, that's going to give you really crisp videos. The problem with that is actually recording a wider field, or switching from the lower left to the lower right, for example, and getting the different angulations. It's a bit rigid with the scope, but the quality of the video you get is probably the best. And if you've seen lots of clinical videos, you can probably agree that these are the really crisp videos you see, but they lack that point of view which these Loupe mounted cameras do offer. Now, I've tried various things whereby you put a magnet in your phone, and then you mount the phone on something that's aligned to the chair. So this could be the light unit, or I've seen some people use the X-ray machine, would you believe it, right? So it's magnetically mounted to some part of the chair, it could be the bracket table, and that's got an angle to actually see the patient. I've tried it that way, but I just feel it's too far away, and it might be okay for anterior dentistry, but if you're trying to record the lower right second molar, then that's going to be tricky. I'll tell you one exception who records beautiful videos using his iPhone, Dr. Neki Jamal. He's the guy who runs the Third Molars online course, which I rave about all the time. I've done it myself. Every time I take out a surgical wisdom tooth, I will watch one of his cases, and the recordings he has on there are just brilliant. And so when I asked Neki, this was over a year ago, I said, Neki, how do you record your footage? And he told me he uses an iPhone. And so I haven't actually spoken to Neki in terms of exactly how he does it, but I imagine he uses a clip like this. Now, this is a clip that's used in the mobile phone industry for when you're attaching, repairing LCD screens, and you're trying to put it on. And what they usually do is they put the LCD screen on, and they put the phone upside down to put some pressure on the LCD screen to allow it to fixate. But then they discover that actually if you use this clip, it's going to work better. So what I like about this clip, it's got these silicone tips on it so it doesn't damage the phone. And so the beautiful beauty of that is that you can actually put it in all sorts of different angles. So even your nurse can hold it. Obviously, it's better to get something called a gimbal, which stabilizes everything. But just simple little thing like that, your nurse can hold it, and that's a valid way to get some sort of recording done using your mobile phone. But I suppose Neki had it over the patient on a tripod with something like this, which allows you to sort of maneuver the camera like so. So if you want to use a mobile phone, I'll put the link to this in the show notes. I'm going to call it a silicone clip. And that's one thing that you might wish to use on a tripod or some sort of system that you might want to sort of DIY yourself. But this video is primarily about the OXO, which I'm coming to. But you can use a mobile phone for recording. It just takes some experimentation and you have to get a little bit creative. Now, a few years ago, I paid about £400 for this kit. I'll show you what it includes. It's like this Panasonic 4K camera. And I tell you, it was £400 down the toilet. It was really laggy and difficult to use. The footage looked good, but I wasn't happy with the software and how clunky and laggy and slow everything was. Things would heat up. I wasn't happy. So this had like a little Velcro strap, and I'll show you what the headband looks like. So it's mounted on one of these headbands, and I would have Velcroed this part onto the back over here, and then this part would clip in like so. And obviously I'll move the wire out of the way. I've actually forgotten exactly how I did it, but you get the point, right? It was coming out here and I tried it and I hated it. It wasn't good. It was £400 wasted. Now, there are other systems out there, such as the Futudent, for example. The Futudent has a reasonably good reputation. They seem to market a lot. I've never actually used a Futudent, but when I was coming to making my big purchase of which camera system I was going to go to, I found a clinician on YouTube called Pedrosa. And I'm going to just point you guys to his channel. He does some great work and I want you all to support him. Check his work out. He records all his footage or a lot of his footage with the OXO. And so I reached out to Lucas and very kindly gave me some advice. He actually gave me a lovely reply talking about how he's used a GoPro mounted on the head. He's used the Futudent and he used the OXO. And the long and short of it is that he preferred the OXO. So it's based on Lucas' advice that I went for the OXO. Now, I want to make sure I'm factual and I don't actually use a Futudent. I've never used one, but I know there are various models and I don't want to get too much into that because I haven't used a Futudent, but I know that some of them are wired. The thing that Dr. Pedrosa told me is that the image stabilization wasn't up to his liking, and he likes the image stabilization of the OXO. But the downside of the OXO is that it records videos in 3-minute chunks. So we'll talk about that a bit later. The Futudent was a lower price than the OXO, so that is a factor as well. But like Lucas said, he didn't like the image stabilization, but both the weight of both the OXO and the Futudent was very light, he said. Now, when I wear my OXO, I'll show you later, it does leave some marks from the nose pads on my nose. It's very bearable and it's okay, and we'll talk about that when I talk more about the OXO. The other disadvantage of the Futudent is the fact that it is wired, and he wanted a wireless option. Now, Futudent may have some wireless options, but at the time of speaking to Lucas, he told me the disadvantage of Futudent was that it was wired. Maybe they have some wireless ones now, but the OXO was a wireless one, which you can sort of stream to your iPad or tablet or phone like I do. And nowadays, wireless, it just is nicer. Okay, so I've been kicked out of practice and I'm here in my office. And I'm going to demo to you how I actually use the OXO. So step 1, let's get it on. So there we are, it's on now. As you can see, it's fairly stable. I'm actually going to show you a live view of what you see from my camera. And that way I can explain what you see, how to set it up, but also some sort of pros and cons of the OXO. So step 1, I'm going to switch it on. You switch it on by pressing the on button for about 3 seconds, I think. It'll make that sound. What you then need to do is you need to connect the OXO to a device such as a phone or an iPad or a tablet or any sort of tablet. I've done it on an iPad before. I've done it on a Samsung tablet. I've done it on my phone. And so I'm going to show you on my phone how to do it. So I'm going to actually go and start the screen recorder so you guys can see what I'm doing. So I'm going to connect to the OXO app. So it's got its very own app basically, and it will tell you to turn on the camera. Now obviously the camera's already on, so what we need to do is actually change the Wi-Fi. I need to change the Wi-Fi to the OXO itself. So at the moment I'm connected to my home Wi-Fi and I need to connect to the OXO. So you'll see that the OXO transmits its own Wi-Fi. That's how it communicates with the device. So while that's loading, I'll answer a common question, which is, do you need to have a device? Can't you just switch it on and start recording? Well, you can't, but there's a good reason for that. Like, you don't know where you are. You don't know exactly if you've got the right framing and the setting correct. So the whole time when you're recording, you need to have a device. You need to have a phone or a tablet or something on at the same time. And if you want, you don't even have to look at it. Once it's on, you've got your settings right, you just do your procedure and you record it. You don't even need to look at it, but you need to have a device running at the same time. So what I've done now is I've connected to the Wi-Fi. I'm now going to go to the OXO app. And it will say turn on camera, and the camera's already on. And there we are. Now we can see everything, and yeah, pretty good actually. The framing's pretty good already. Now I'll switch on the light, but I'll show you a few of the settings and how you can play around with it. So first thing is select resolution. So you can choose to record in 4K. Okay, 120 frames per second is actually pretty cool. It actually records things in lots of frames so that you get this like super slow motion effect, which is pretty cool. 60 frames per second looks really crisp and nice, but if you want to save on data, you can record 720 or even 180, right? So your choice. I tend to usually record 180/30 or sometimes 60 if I want something really slick, and sometimes 4K, right? Depending on how long the procedure is. If it's a short procedure, 4K. If it's a long procedure, it's take me 2-3 hours, then I'm going to choose 180p at 30 frames per second. So the file sizes aren't too big and I don't have to change the SD card halfway through. So on the topic of SD cards, let's talk about it, right? It takes a 32 gigabytes SD card, and I'll put the link in the description. Can it take 64? Yes, it can, but it's a bit buggy. Like even they say, look, it's a bit buggy with a 64. It's a bit experimental, and I've experienced this. So I have loads. I've got like 15 32 gigabyte SD cards. They're not very expensive. Top tip is to have lots of these 32 gigabyte SD cards. Right, so for the purpose of this, I'm actually going to select 4K recording, and so that's our resolution selected. And if you change the screen, it allows you to click OK, fine. So chose the resolution, next, focus your camera. Now the focus is actually via this part, you twist it, right? And that actually changes your focus, and it also comes with a focus card. Focus card is a handy little tool. Now and again, like if you think that the focus is not good, you get a live preview. So for example, let's actually look at this model that I'm holding. Now firstly, the framing is, before we get to the focus, let's fix the framing, right? The tooth I'm looking at, which is the upper molar, is too high on my screen. So you can actually move the camera up slightly, right? So move it up. Do you see that? I just moved it up a few degrees. And so now I'm going to take a look. I've gone too high, right? So if I go lower, so I've gone too high. So now I'm going to go a little bit lower again. Just a tiny bit. Yeah, that's pretty good now. So I can see that first molar. It's relatively in the middle of the screen. I can tinker around with it, obviously. Now, in terms of checking the focus, it's pretty good. Now, if I start adjusting the focus, you'll see what happens. If I go too far one way, it gets a bit blurry, and I go the other way again. And it's easier to do with a focus card, which I haven't got with me. But yeah, you could play around with the focus. And once the focus is set, that's set to the working distance. And so anything in that region will be clear. Now, if you come too close, it loses focus. And if you go too far, it'll lose focus. So it's kind of like your loupes, right? So the beautiful thing is that the view I get from my loupes, which is I can pretty much see the canine to the wisdom tooth there, is exactly what I'm seeing here in the screen. Like, I love that my 5x loupes are mirroring what the video. So I know that if I can see it through my loupes, that the video is also capturing it. So I love this about my 5x loupes. Something also that Dr. Lucas Pedrosa mentioned as well. Now, the next thing, which you probably need some help with when you get started with the OXO, is setting the white balance, right? So I'm not going to touch this because I really don't want to mess up my white balance. My white balance is really good, but there's a little white balance card that you get at the time of setting up. So I would advise you to use that. And that's it. You're pretty much good to record, right? So I've now got my phone, and I would leave this phone somewhere, like clinically, I would leave it somewhere to the side where while I'm doing my procedure, now and again, I can just check and see, okay, is the framing good? Is the focus good? So as you can see, guys, I'm looking at the first molar. Now I can go a tiny bit lower, but I can just move the model up slightly, and you can see the quality of the footage is really good. And what I then do is I can either press record on the phone, or I can press on my button over here, and it starts to record. You can see how that red button has changed to one with a white circle in the middle. So now it's recording this in 4K. And it's easy as that. You just keep recording. Now, when it comes to actually managing the files, what you end up seeing, and when you actually insert your memory card into your laptop, is lots of files, right? You don't get one big file per recording. It actually breaks up your videos in 3-minute segments. I think it's something to do with the fact that you don't want it to crash and be buggy. And like, imagine you're recording this long video and something was to overheat or crash and you lose all that video. That'd be terrible, right? So I think that's the reason. I don't know if it's the actual reason for sure, but it records everything in 3-minute chunks. Look, the quality of the recording is good. The stabilization is good. The focus is good. So it's a relative disadvantage that you don't get one big file of your recording, and it doesn't mirror every time you press record on and off. Like if you press record and you're recording for 2 minutes, yeah, it'll record the whole thing. But if you're recording for 4 minutes, it'll give you a 3-minute file and a 1-minute file. So that's a relative disadvantage. But nowadays with the video softwares, it's very easy to edit. And as you know, I have a team that edits all my work. If you went to my webinar, which is all about my productivity secrets revealed, I told you all about my lovely team. That webinar, by the way, is available on protrusive.app. Now, I just showed you the OXO in action in terms of the interface of the phone. It's relatively easy to use. But I'm going to show you a few more tricks and tips. Okay, so when you click on settings, now there's a plus button that you see. And with that plus button, you get to do a few more amendments. If you go into the video settings, you can actually change your field of view. So for example, at the moment, I'm a narrow. I found that narrow, it mirrors my loupes really well. Now, I'll show you what a wide view looks like. So let's click OK, and let's go back. I'm going to switch the light back on. So this is what a wide view looks like. Okay, you can see a bit more of the arch, and I can see more from the camera or on the phone than I can with my loupes. So that's why I like and I prefer the narrow view. So I'm going to change the field of view back to narrow, and you can obviously play around. So if you're doing a larger field, like you're doing a large field, a full arch implant kind of case, you maybe want to go for wide, you want to see everything. But if you want to do like a single tooth or quadrant procedure, which is what I'm usually doing, you're doing a narrow view. The rest of the stuff I don't really mess about with. I like the fact that it records audio, so I keep that. And you want to keep on image stabilization. You know, image stabilization is a really cool feature. It helps the quality of your videos. So here we are, just for comparison, this is a 2x view. Now, when you have this on your loupes, to make sure you're not very shaky, because some of my videos in the past have been a bit shaky. It's a steep learning curve, like with everything, right? I want to make sure this is nice and snug and tight. If it's too loose, if the loupes are too loose, they're going to be shaking about too much, and therefore your footage will be shaky. So for the first month, you remember when you started with dental photos, right? Your dental photography, your first few photos absolutely sucked, and it took you a month to get good at like framing, and it took you 6 months to actually take a decent occlusal photo. It's a bit like that, right? It's a bit of a learning curve, and you have to be patient, and sometimes you'll forget to hit record when you're supposed to hit record, and sometimes you look back at the video, and the focus is good, but it's not perfect, and it could have been better. And so really you need to train your nurse to be your partner in this, and to help you out, and to give you good feedback on the focus, and to also learn to give you feedback on the framing. So sometimes I'm like, hey Zoe, do I need to go higher or lower? And she's like, yeah, it's good, or actually no, go higher, go lower. And me and Zoe work at a level whereby I'm comfortable with her advice, and she can actually guide me quite well really quickly. So I don't have to keep looking at the iPad or the device and looking at the teeth. I can actually just go by what she says, and if she's happy, I'll just double check. And most of the time now, Zoe's actually pretty good. So it's good to train up your assistant and to just experiment for the first month or so. It'll take you a little while to take consistently good videos, but I promise you it's so worth it. Now, when you're done, obviously you can just switch it off, and you can take out the SD card. Now, you want to hook up the micro SD card through your laptop, and then you can view all your files. And you can do what you want with those videos. You can send them to your patients, you can trim them, you can make Instagram reels, you can make educational videos out of this. You know, it is totally up to you. You can send it to your mentor for advice. So all those advantages that we spoke about earlier about video, it is all possible. It's all about getting quality videos, and that's what I find with the OXO. So just to summarize, the phone is good, whether it's your assistant doing it or you get some sort of clamp. It's a good way to start, but if you really want to get high quality footage, like a point of view, then get a microscope. But the next best thing after a microscope, which actually gives you a bit more versatility in terms of all the different angles and being less rigid in a way, is the OXO camera. Now, there are other brands available, and some I've tested, like that Panasonic, and some Dr. Lucas Pedrosa has tested, like a customized GoPro solution and a Futudent, but the OXO comes out as a clear winner. Some great dentists like Basil Mizrahi use it, as well as Rob Oretti, and there's so many other clinicians, and there's a reason why all these top clinicians are choosing OXO. Now, this is the bit that you've all been waiting for. How much does it cost? Okay, so it costs over £3,000 plus VAT to get an OXO camera. Then you also need to factor in the light. The light is around £500 plus VAT. Colleagues Mahmood, he's got a headband version which he likes. So when the rep comes see you, they'll show you all the different kits. So you're looking at over £3,000, and by the time you calculate in VAT, you're looking at over £4,000. Is that a lot of investment? Well, yes and no. Nothing worth having comes cheap, right? This is a really high quality build. And it's allowed me to get angles and videos which I never thought I'd be able to do. And for my love of video, for my enjoyment and fulfillment of dentistry, it has totally been worth it. If you love the idea of documenting your case through video or getting really specific mentorship, then this is a great tax-deductible investment.
Now, I love it so much that I've partnered with Evident, who supply the OXO in the UK, that we can offer you a coupon code. So if you'd like to have a coupon code, you have to contact us. So you have to either reach to us on Instagram or email jazz@protrusive.co.uk and just say hello and that you'd like a coupon code for OXO, and we'll get you sorted. I have to say that the customer support from Evident has been brilliant. Like, when I got the camera, there was actually a dust speck on my lens, which apparently is very rare. But as soon as I put the camera on, there was like this dust speck right in the middle of my video. And I'm like, what is going on? Is my screen cracked? I contacted Evident and they were like so apologetic. And within a day, they sent me this spray and told me all the instructions. It was really easy to do. And it's been absolutely brilliant ever since. I've had no hiccups with it. All of the sort of learning curves is something that's expected at the beginning in terms of learning to create high quality content. But the professionalism and the customer support from Evident has been brilliant. And what they've even done for you guys at Protrusive is offer a 5% discount. So the coupon code will give you a 5% discount. And if you simply reach out to Protrusive, we will help you with that. Remember that you do actually get a rep coming out to you, because it's kind of like Loupes, right? It's like a bit personalized. They want to figure out what it is that you want to use it for. How are you going to get the most out of using the OXO? So they guide you with that in terms of all the different kits that you may or may not want. And overall, I'm really, really glad I came across OXO. If you have any questions about dental videography or the OXO device, just please post them in the comments and I'll be happy to answer them. Hope you've enjoyed this review of the different ways to take video and my experiments of the past, and why I now am using an OXO and I get the best quality footage with the OXO 4K camera. Please don't forget to hit the subscribe button, and I'll catch you soon in another video.